Welcome to Healthy Smiles for Life. I'm Brad Sattin, and today we're at the Gendler Dental Center. We're in Hopkins, Minnesota, just outside Minneapolis. And we're talking today to Dr. Joseph Gendler. He is board certified from the American Academy of Implant Dentistry and is one of just 4 dentists in all of Minnesota certified by the American Board of Oral Implantology. And today we're talking about full mouth reconstruction, dental implants, and how lives are being changed one patient at a time. Dr. Gendler, great to see you. It's got to be really fulfilling to know that you're making smiles and creating better health.
It's good to see you, Brett. Thank you so much for having me on the show.
So let's start with who your patients are.
You know, we have all kinds of different patients, from celebrities, business executives, but most of our patients are everyday people, people that you see in groceries, into airports, people who work.
All walks of life.
All walks of life.
Let's talk about the services you offer, generally speaking.
You know, in this office we do offer services from a simple fillings and cleanings all the way to a full mouth reconstructions. And we have a lot of specialists, and that's why we offer a very broad services.
So there are probably 2 types of patients: those who try to take care of their teeth and their gums but still have problems. Let's talk about them first. People who are coming in who are caring for themselves but still have issues, I guess.
You know, we see people who go to a dentist like they're supposed to. They brush and floss and they do what they're supposed to do, but unfortunately they still end up with bad situations and they need lots of help.
And then there are those probably who haven't been to a dentist in 20 or 30 years. Why? Why are they coming to you now, and why hadn't they been taking care of themselves?
You know, this is a special group of people. These are special people. And the people who are literally afraid of going to a dentist. A dentist office or a dental chair is kind of like a monster to them. So, and they avoid of going to a dentist for years and years and years. Most of these people have a backstory, and a backstory is that something happened in their lives and it got them scared, and they just stopped going to a dentist, and they wait up to a last moment. They stop, they miss lots of things in life. Many of them, they just stay at home because they are afraid of going to people, and but something one day, it's kind of like a straw breaks a camel's back, happens, and they say it's time to go to a dentist. And it takes them lots of courage to pick up the phone and call.
And some are afraid, but I imagine some are embarrassed even to come to the dentist.
Exactly. So, and plus these people, they miss 1 year, 5 years, 10 years, and then they don't want to go to a dentist because they don't want a dentist to tell them that, start to scold them about. That's why they just avoid it.
And then we're going to get more into this, but some probably are afraid of the cost, saying there's no way I can afford all the work that probably needs to be done.
This is a big thing. Because people hear, okay, I'll need a dental implants, and every dental implant is, let's say, a few $1,000, and I need a 20 or 25 teeth. Oh, it's going to be expensive. So, and they think that it's going to be super expensive, and they just don't go to a dentist.
Let's talk a little bit about self-image, because I think that may drive a lot of people saying, I just can't take it anymore. I'm always so self-conscious about my smile or how I look. Do you hear a lot of those stories?
That's probably number one reason why people, they pick up the phone and call. Because people are so conscious about their self-image. I mean, anytime you meet anybody, you smile. So that's the first thing you see. And if people know that they have a bad a smile or no a smile, they are just try to avoid meeting people, or they try to hide it, and or they simply just don't smile. And when you don't smile, you get an image that you are angry grumpy a person. On the other hand, some of these people are wonderful people.
And whether you're on a date or a business meeting, if you're not smiling or you're hiding your teeth or you got something going on, people do notice.
Of course, of course. And people, many of these people, they just stay at home. They don't go out. They don't do anything because they don't want other people to see them with bad teeth or with bad smile. People are scared of uncomfortable situations. Like a patient of mine, he told me that he got animated, he was telling a story, and then he feels like his partial is coming out. So he stopped, excused himself, went to a bathroom. People, they don't want to be into this uncomfortable situation.
So there's a lot of reasons. You talk about not being able to do activities. You even knew a scuba diver, right?
Yes, it's one of the story. A patient of mine, he went scuba diving, and basically you hold a regulator with your teeth. And while being underwater, it got dislodged, and dentures are not stable. So, I mean, he started to choke. And at that moment, he made a decision. He needs a teeth that stay in.
Well, I would think in that situation, that could be life or death, right?
Exactly.
When you're underwater.
I know another story. A patient of mine was skydiving, and all of a sudden, while being into the air, his dentures are coming out. And guess what? He needs a new pair of dentures.
Yeah, you're not going to find them in one piece on the ground. So we've talked a little bit about image. Let's just talk about the pain that can come with, work that hasn't been done in your mouth.
If you have lots of infection or broken teeth, it's constant pain. People, they start to take medications, a massive amount of medications. And because of these medications, they start to feel sick, and they feel lots of pain in their mouth. They stay home. They don't want to go out.
One time I had a toothache, and my whole body ached as a result. So I can certainly understand that if you have issues within your mouth, it can affect your overall health.
It affects everything. It can start with one single tooth.
And so let's talk about solutions. There are answers here for folks, right?
Absolutely, absolutely.
So,
there is always hope.
When we talk about full mouth reconstruction, what are we talking about?
Full mouth reconstruction is basically anything more than a simple filling or cleaning. It's basically taking care of your teeth and gums, jaw, joints, and the whole chewing apparatus as a whole. So you need to see one big, broad picture. So many times you go to a dentist has a tunnel vision. So they look into one or two certain things. You need to be able to understand the bite and jaw joints. That's what basically full mouth reconstruction is taking care of the whole thing as a whole.
A big part of it, though, are dental implants. Can you tell us what they are? What is that?
It's a small titanium appliance that is being placed into a jawbone, and a titanium, it heals with a bone very well. Basically, it can hold a permanent teeth or even help you to make what's called a snap-on appliances if you have uncomfortable denture that snaps into these implants.
It's better than a denture. It's certainly more permanent than a denture?
Yes, so that's what we specialize in, is basically a permanent implant-supported teeth. That's what we do most of the time. These are teeth that are being permanently anchored to a jaw, and they are almost as good as a natural teeth.
What about patients who have bone loss, though? I would imagine other dentists may have said, nope, you have too much bone loss to even have this procedure. Is that an issue?
Yes, it's a huge issue because if you have dentures, if you don't have a teeth for a long time, bone, it resorbs, it goes away. It's called atrophy. If you don't have a bone, it complicates the whole situation to place a dental implants. In this office, we do use a specialized type of implants, which are called zygoma implants or pterygoid implants. Basically, with this type of implants, you don't need a lot of bone into a jaw because we anchor these implants into a very strong cheekbone. Or into the bone behind the sinuses, which is very strong.
Most offices don't offer this?
As far as I know, we are probably the only one in Minnesota area who offer this type of implants. And many dentists, now that they don't offer it, they don't even hear about this type of implants. So I had a patient yesterday. So he's been to, I believe, 6 offices, and he was told that no, absolutely nothing can be done for him. And when I explained him that we can help, he started to cry. A grown-up man crying.
That's awesome. Again, you're changing people's lives. Who is a good candidate? I guess you would encourage people to come in and find out, but who would make a good candidate?
You know, anybody. Basically, we have a major 2 types of patients. One type are people who have dentures and they are unhappy with their dentures or want something more stable and permanent. And another type of patients are people who have bad teeth and they need lots of crowns, root canals, and partials. Once you add up a cost of this individual dentistry, it comes to be a big sum of money.
So maybe going the dental implant route could be actually cheaper in the long run than having 12 unrelated different procedures going on?
Exactly. And many times if you just add up a cost of root canals, crowns, and this and that, and then see that we can just use a few implants and make a permanent teeth anchored by these implants, it can be cheaper and it can be more permanent. Think about this. If somebody has a history of cavities, bad teeth, even though we fix them, he might get the same type of problem 3 or 5 or 10 years down the road. Implants, they don't get cavities, and they just are more permanent things.
And just to be clear, you don't necessarily push everybody down the implant path. What you do is really customized. You talk them out and figure out what the best solution might be, and there could be choices that folks make.
Exactly. So we talk to people first. Let's say somebody has dentures. They don't mind dentures, but they want just more a stable type of dentures. Then we talk about anchored dentures or snap-on type of dentures. Some teeth are wonderful, so we want to save these teeth. Basically, we talk about desires, priorities, a budget, situations of what's going on, and it's kind of like a puzzle, and we put a whole thing together and offer choices to patients.
I think another big benefit is the comprehensive care. You come here and you can get all of it done in one place. That's a little unusual, isn't it?
It's wonderful because we have a gum specialist in this office, we have a TMJ or jaw joint specialist in this office, we have a general dentist in this office. Besides that, we have a laboratory in this office. And we all talk to each other. The communication is great. We can all sit down and make one plan.
Let's talk a little bit about what a smile can mean to folks. You've seen it, and we're going to look at some, I guess, pictures and some demonstrations in a moment. But what do people tell you when they look in the mirror for that first time and see a new smile and maybe in some cases a new set of teeth?
A smile is huge. A smile is something that you see a person a first time and you make a judgment about this person. Especially for people who had a bad smile or no smile for a long time. And once we do a new teeth for them, the first time they look into a mirror, they start to choke. I mean, they start to cry. It's kind of like epic moment, you know, and usually we bring the whole team just to see this moment.
And I imagine it restores their confidence, their charisma, their outward appearance, how they feel about being in public again.
It's horrible that something so important, a smile, was robbed of you. Once we give a smile to people, a different personality, it comes out.
Now, vegetarians might not relate to this, but it also means you could eat a juicy steak, maybe for the first time in a long time?
You know, as vegetarians, you need teeth to eat vegetables as well. And you need, even if you eat corn on the cob, try to eat corn on the cob with your dentures or with no teeth. You know, try to eat a lettuce with no teeth or dentures. You know, obviously we all know about a joy of eating a steak.
So let's get back to affordability and the cost here, because for a lot of folks, that may be the number one thing that goes through their mind. Part of it is getting it right the first time, that initial consultation and kind of figuring out what direction you want to go. How does that relate to the cost, and what should folks know?
Cost of dental implants, it can be high, but since we do a lot of this type of procedures in this office, and plus we have a laboratory in this office, we can minimize the cost and pass this as savings to patients. And we do see a lot of people for second opinions that go to specialty offices, and they come to us and they get a better stuff, a better teeth for less cost.
Expertise and experience counts.
Absolutely. So you want to go to a right person. I mean, you want to go to a person who has a lot of experience. And this is a different animal. Full amount reconstruction is different than doing 1 or 2 or 3 implants. So you need to understand more. And a key is to do it right a first time. Because if things are not done right a first time, to redo things, it'll cost you 3 or 4 times more. I see a lot of people who want to save money and go to Mexico, to Russia, to do a cheaper type of dentistry. Then once we start to redo this type of cases, it's costing them so much more than to do it right the first time. And it's not just money, it's time, it's pain.
Let's talk about the procedure itself. People are sedated, patients are sedated. How does that work, and what should they know about that?
Yes, so we do it either way, or we do it with a Novocaine, so it works great for lots of people, or we do use a sedation. I do a sedation or myself, or I use an anesthetist. And most of the time we do what's called IV type of sedation. One is a pill sedation, that's what most of the dentists do, and IV type. IV is the same type of sedation that is being used in the hospital, and it's safer, it's better. If you do a pill sedation, it takes time to go through the GI tract, and it's not as predictable as IV. If this is IV, you just start in 5 minutes, a patient are sedated.
But again, folks come in with anxiety. This is something you'll talk out with them and explain and make sure they're comfortable with.
Exactly.
How quickly can these procedures be done? Are we talking about days or weeks or months and 10 appointments, or?
That's a beauty of having experience, a beauty of having a dental lab into this office. Because usually, typically this type of procedures, let's say we are talking about a full amount reconstruction and implants, it would take years. I mean, it would take to take the teeth out, to graft the bone, to come back, to place implants, and then start to make a teeth. We can do this whole thing from A to Z into every month.
So in the course of a few days, a few weeks, a month, you can come out with new teeth.
Absolutely.
That's pretty
Absolutely.
amazing.
Absolutely.
You have some real life examples you want to show us, because, you know, what do they say? A picture's worth 1,000 words.
Exactly.
So let's start with Gina.
Gina. So she is one of my most favorite patients. This is Gina when she first came to our office, and she has a story. When she was young, she lost all her teeth. She was depressed. She basically stayed in her home. Her mom helped her to pay for the treatment. So she came to us, finished a treatment, and gave her a permanent teeth. They don't come out, and she looks like this now. Look at this and this. Now, just to tell you, she's a supervisor at her job. She has a boyfriend, And because of as simple as a smile, her whole life changed.
Well, you have other dramatic transformations as well. This is Teresa.
Yes, and that's how she came to us. No teeth. She wanted something permanent, and she went to many offices, I believe 5 or 6 offices, and she was told that she physically has no bone to do it. And then when I told her that we can do this as specialized types of implants, she cried. And that's what she looks like now, a completely different person. It's amazing, humbling to be part of these types of transformation.
Oh, it's got to make you feel amazing.
I love it. I love it. I love these people, and I love what they do.
Next, we have Joy, who had gum disease, right?
Yes, she's a mom of one of our employees. She took care of kids, a household for many years. She did not go to a dentist for many, many years. Her teeth got worse, worse, and worse. She started to hide her smile. And one day she allowed her daughter to drag her to us. And that's how she used to be, a severe gum disease. And once we're done with her, that's how she looks like now.
An incredible smile.
It's not just a smile. It's a new joy. She can eat anything she wants. Whole new person. It comes out. And people, they start to enjoy it again. They start to do activities.
And at any age, right? Next, you have who? Constantine?
Constantine, amazing guy. And guess how old is he here?
Boy, oh boy, I'm a bad judge of that, but I'll guess he's 75.
85 years old.
Okay.
Some people ask, is age a factor? No, we did it when he was 85 years old. Look at him now.
Wow.
And it's not just the teeth, it's eyes, it's a whole facial expressions, it's attitude.
That's amazing. We have a few more. Beth is next. Had an infection and gum disease and a bunch of issues.
She had lots of pain in her mouth, lots of felt root canals, crowns, and a constant pain. She was at home most of the time.
We're hearing that a lot, right? People staying at home.
Yes, and taking tons of medications. She was referred to me by a colleague of mine who attempted to do a teeth with a traditional type of dentistry. But teeth, they broke off, and they had no choice as to refer her to me. Mm-hmm. She lives in Philadelphia area, so she traveled to us about 3 times. So the first time we did a surgery, a temporary teeth, and next time we did a permanent teeth. That's a beauty of having a laboratory in the office. And third time we saw her just for a post-op. And guess what? When I saw her a second time, she was a new person, meaning she stopped taking her medications. She is smiling. She jokes. That's how she looks like now.
Wow. Just
It's
amazing
completely
smiles.
a new person.
Ken is next, missing back teeth.
Ken is a wonderful man, and it's a typical case what we see in this office. He did not go to a dentist for many years. Missing a back teeth, a cavities, a broken teeth. Yes, we could fix him up with a combination of root canals and crowns, a gum surgeries. But once you start to add up the cost, it comes to be so much more than just to do the implant-supported dentistry. So basically, when we are done, that's what he's got.
They look pretty close to perfect.
Exactly, it's great. Look at his face.
And again, as you say, in his eyes, you can just tell.
Everything is changing.
Yeah.
So
we got 2 more quickly. One is Miley, right?
and Miley is a younger patient who, unfortunately, due to a gum disease, she lost lots of teeth. She went to a dentist on a regular basis. She brushed, she flossed, but still, she lost lots of teeth. We got her a full amount reconstruction, and she looks like this now. Completely a new person. Also, she had an underbite, and we were able to fix her underbite and give her basically a healthy set of teeth. So she's just a healthier person.
Yeah, you can tell. And lastly, Vicky.
So she's one of my most favorite patients. That's how she came to us. She had 5 or 6 kids, and she did not have time or means to take care of herself. And then one day, kids helped her out.
Her kids?
Yes. And she came to us, and we did a full amount reconstruction. And look at her and now. It's completely a new.
Not just the hair, the teeth.
No, she got a self-confidence so high. She was so excited about this. She lost a weight. She changed her hairstyle. It's completely a different
She looks
people. So, and it's not just looks. It's a whole outlook to life.
So what is the number one thing, if you put them all together, the first thing that they tell you as they see their new selves?
You know, if there is something that you don't like about yourself, you hold it back. You hide it. You know, it's kind of like if you go into the room and you don't like something on your nose, you think that a whole room is looking at you. You try to hide it. If this is taken away, people, they just open up.
And they're probably saying, why didn't I get this done sooner?
Exactly. I hear this every day. Why I did not get this sooner.
You know, we talk a lot about costs and all. Let's talk about insurance for a minute, if we could, as we kind of come down the stretch here. You know, as part of a comprehensive plan, it's not just the teeth, but it's ensuring the finances can work out as well.
Yes, unfortunately, dental insurances, they don't pay much for this type of treatment. They pay more for a cheaper version, dentures, but they don't pay much for a permanent implants. Good news, yeah, we are one of the few who works with a Medicare or medical insurance. A Medicare, it will not pay a whole thing for the treatment, but it'll help. It'll pay some. So
you had a patient, I like his name was Brad.
So he needed a combination of dental implants and crowns and bridges and so on. But he did not have means to do a whole thing at once. So that's why it took us a few years to do a treatment. A dental insurance has a limit. It's usually $1,500 to $2,000 a year. So, and to use up this limits, we prolong a treatment.
So you can do things over time to make the budget work.
Exactly right. It's called a planning. So
it's called planning, yep.
A treatment planning, a financial planning as well.
Okay, makes sense. So as we kind of wrap up here, I think the feeling that folks should get is that there is hope here, right? If you have a situation that's really impacting your life, there's a way to at least take that first step.
Yes, there is a hope, and we do have expertise to help you. So if you are conscious about your smile, if you want to eat again, give us a call.
And the first step would just be that initial consultation, no obligation, right? But you can kind of talk about what the options may be.
You know, a first step is to pick up the phone. So for some people, it takes a lot of courage. Please pick up the phone and call us. We'll meet and talk about options. And there are no obligations. If you decide to do it, great. If you decide not to do it, it's fine with us.
And the consultation cost actually really is very, very low. We want to mention that if you see this program and mention this program, that you can get even a special low price. But it's not going to cost a lot to come in for a consultation at all.
No, it's not.
Well, Dr. Gendler, thanks so much for joining us. Really, we're talking about healthy smiles, and we've seen a number of examples that show there's a lot of hope out there. Take that first step.
Thank you so much, Brad.
It's my pleasure. And so now is the time. No longer do you have to put off a good, healthy smile. You can eat all the foods you want, regain that confidence, and live your best life. And you know what? It starts with just a phone call to the Gendler Dental Center. The number is on your screen. You can also go to their website at implantmn.com. I'm Brad Sattin with Healthy Smiles for Life. Now go out and live your best life, and thanks so much for joining.